Does the vaccine work against, we've heard all this coming out now about the different strains that are coming out. Does the current vaccine work against those different strains of the COVID-19?
It covers a vast majority of the most prevalent strains right now. Now, there are several additional strains. The UK variant, as it's often called, was tested against the Moderna vaccine, and there was significant efficacy against it. There is, however, a South African strain, a Brazil strain, and now a California strain, all of which have some resistance to it. Now, that's not to say that the vaccine is completely ineffective. It just has slightly less efficacy against these particular strains. And that's because the coronavirus does mutate on a fairly frequent basis. Now, a lot of these mutations that happen make it less infectious, less dangerous. But once in a while, if you move this virus around enough, you will get one strain that is more infectious, and that one generally becomes more prevalent. So the vaccine will cover a vast majority of the existing ones. And why that's important is because every person that's infected will have some mutations taking place within the virus that's in their body. So the less people that we can get infected, the less opportunity that this virus has to mutate. And this is where also those what we call non-pharmaceutical interventions really help. So masking, hand washing, social distancing. Every person that we can prevent or even delay infection in is less likely to have a mutant variant that could evade our immune system and this vaccine. So by and large, it's extraordinarily important, even if it's not 100% or like these great vaccines that are 95% effective, because that's really an incredible number for a vaccine. Even if it goes down to 65%, so you're vaccinated, you get one of these odd strains, if you can slow the spread of it down, then you slow the spread of the mutations and you will eventually get control of this disease. But it's a combination of vaccinating against the most common types and the non-pharmaceutical interventions, hand washing, mask wearing, social distancing, and we will be able to get control of this. And the benefit in addition to that with these new mRNA vaccines is that as we sequence these mutations, if one of them does become more predominant, all of these mRNA companies that are developing vaccine right now, they can modify the vaccine on the fly and begin sending out booster doses if necessary to cover these newer strains of it, so that we can respond to the vaccine we can respond to the virus with the vaccine almost as quickly as it can mutate. So we can truly stay ahead of this, but it really does depend on us getting a large portion of the population both vaccinated and using the masking, hand washing, social distancing.